Hi there, Dr. Sclafani here from One Manhattan Dental. I'm here with my partner, Dr. Robert Raimondi.
Hello.
I want to take a moment to express my deepest gratitude to each and one of our amazing patients. Thank you so much for making 2023 a spectacular year for our whole practice. Your trust and support has made this year spectacular for us. As we look ahead to the new year, I'm very excited about new innovations that we're introducing to our practice, all the joy and happiness it holds for all of us. Rob, you want to say a few things about technology and things I want to introduce?
Yeah, I can build on that. The greatest gift that all of our patients give us is your trust. Your trust means a lot to us. And since we have this great gift, we always look at what we can do to stay on top of technology and techniques to make sure that we are not ahead of things, but as close as we can be to proven technologies and techniques as possible to take the greatest care of our patients. So the one thing that we're doing is to create a lot of content for our patients and the world. We try to create things that you find valuable, taking conversations that we have with each of you individually and share them with the rest of our patients through things like this, through our monthly talks. It takes a lot of time to schedule to do that, a lot of effort for us to do that. And we feel that we're giving a great value to everybody by actually connecting with you and echoing the conversations that we have with individual patients. So if there's anything that we're not getting to and anything that you'd like more of, please let us know. It's a great forum to email us, text us. When you see us in the office or one of our team members, you can share with us things that we can talk more about or things we're not getting to that you think would be important to touch upon.
This will help shape your experiences and your outcome for future treatment, which works best for all of us.
And to focus in on the actual appointments, we spent a lot of time this year, Mark and I and the rest of our team, with a lot of attention on what your hygiene visits are like. It's the opportunity where we see you the most, and hopefully you see us the least, maybe just in the hygiene room for just a short time. And so we spent a lot of time on what that appointment looks like. And we created a couple of things that could help give you information. And we feel that through our content, through these things that we're giving you in the hygiene room, we're empowering you as a patient. The best patient is an educated, empowered patient that can utilize us as a tool to take the best care of yourself and figure out what that means and what to do, what not to do around that. So one thing we're creating are forms such as a radiation form. What are the x-rays that we take? What do they mean? Some people don't think twice about taking x-rays. Some do. Some pause and like to understand what they mean, what they are. So we have forms and things of the exact radiation that we're exposing you to when we do anything here in the office. So we have that for your appointment. Our hygienists are empowered with a really great system behind the scenes. We worked for half the year to create this home hygiene plan for you. It takes them about a minute to create the form. Took us 6 months to create the form of work, but the hygienist can actually in 1 minute develop a plan with you and share the information of what products you should be using, what order, and what.
Not every patient's the same, so not everybody's using the same toothbrush, the same toothpaste, the same rinse, the same floss. So we try to customize it for each and every patient in the practice.
Right. We get the conversation all the time. What is your favorite blank? Could be toothbrush, could be toothpaste. And there's not a favorite.
Right.
It's utilizing the technology that we have, using the products to figure out the best thing for you. And so our hygienists are empowered to do this easily, share it with you in a format that shouldn't really get much resistance to getting a focused appointment.
What we mean by that is that an implant patient is going to use different products to clean their teeth, and then the patient has no restorations in their mouth, or a younger patient who has no dentistry in the mouth. Someone with orthodontics needs a little bit more help to clean between their teeth, or maybe a water pick and so forth. So everybody's customized differently to fit everyone's needs.
Right. A lot of people are doing a great job in our practice with their home hygiene, but some people might need a little more help, or their situation in their mouth itself changes throughout time. So there's a huge opportunity with our hygiene team and you to customize it as time goes on, as things change or products change. So make sure you involve our team with that to make sure that you're doing everything right. And I think it's a pretty comfortable thing. Yeah. They're doing a good job with it all around. Something we're really excited about to make part of almost all your hygiene visits is a pre-rinse and a post-probiotic, right? A pre-rinse and a post-probiotic. So think about a cleaning. What's happening is the hygienists are cleaning off calculus and plaque around your teeth and around where your gum tissue goes along your teeth, and it's making an open space for bacteria to colonize and populate those areas. So what we're doing is a whole different strategy. We spent most of the year figuring out which products and researching do this to researching it. So what you'll do is you'll start the appointment with the PreRinse, which will kill the bad bacteria in your mouth. We'll have more information in your actual hygiene appointments about this, but it'll kill out all the bad bacteria. And then after the hygiene appointment, we'll then give you a probiotic to help repopulate your mouth with good bacteria. This will all be part of the appointment. There's nothing extra you need to worry or think about, and the hygienist will have everything you need to understand what we're going through. Another thing that we're looking at doing, we've done this on about half of our team members, we've done saliva collecting for patients that are susceptible to periodontal disease. We're looking at what your genotype is. We're looking at your HPV, and then also it's a bacterial culture of the bacteria that populate your mouth to understand how susceptible you are.
Your risk factors.
So we've done this on ourselves, and we've gone through a whole process of this company. And so this will be a thing that we do on patients who we find necessary. If you're having a hard time getting on track with your gum health, or if you're susceptible, you've had some issues, we can really understand at a greater level of what's happening in your mouth from the bacterial standpoint and how to treat you around that. Some patients might even, we're very conservative with antibiotics, but there's some patients that can benefit from a short course of antibiotics to get their gum health on track, things like that. Another measurable thing that we're doing to take a turn in a different direction is to this Grin or PrimeScan is to measure what's actually happening in your mouth over time. And we have two ways of executing that. One is a GrinScan, which is about a 40 second image video of your mouth.
It hooks up to your iPhone. A lot of you might have already had it in the hygiene rooms in our practice. And it gives a quick scan of your mouth where we can measure changes.
Yeah, this is a platform that we're working with this company that can track your mouth over time, changes, and also currently using AI. They're laying a lot of technology in to see gum health, tooth shifting, recession, caries, broken teeth, and over time, it's all built into their platform. So it's a very, very simple thing. To bump it up to a higher level, we have an optical impression that takes 30,000 images per second, and that's a more measurable device. It's a lot heavier type piece of equipment. It takes a lot more time to collect the data, where in a hygiene appointment, it's not something you may want to go through, but for some patients, it may be something that's really warranted if it's something who's grinding a lot or something who's going to have to go through a lot of treatment.
So optically, you can view the teeth on the screen, and the patient can have input and look at the teeth and see the changes and see the teeth that are worn down and broken and so forth. And we can make treatment plans based on that. A lot of times we're using this PrimeScan to design our cases, whether it's a smile makeover or if a patient needs orthodontics and this being sent out to an orthodontist.
Yeah, I mean that's the things we wanted to highlight here. You're also recruiting a fantastic another ceramist to our team to expand our lab more for the actual making of things here in-house. We make most of our restorations here when the equipment is warranted to make in the office. There's some technology that isn't applicable for a dental office where we make some things out of here, but we're kind of ramping things up because as technology is progressing to do more things here, so we have more control over it and get things done quicker at the same level. And there's some other stuff that are exciting as we'll share with everyone down the road. But those are a few things we wanted to just touch base, to thank you for your trust, to wish you a happy new year to follow, and to please share with us things that you need, things that you're thinking about, more information, less information, whatever it may be. You are our bosses while you're here, while we're taking care of you. So let us know what you need from us.
May 2024 give you happiness, joy, countless reasons to smile. Thank you from everyone here at One Manhattan Dental for helping us to smile, work with us, making us smile, and let us help you, make you smile. Thank you.
Bye-bye.